Hi, I'm Dr. Andrew Jordan, Rheumatologist at BJC Health in Sydney, Australia. Today I wanted to talk about Polymyalgia Rheumatica, commonly called PMR. This is actually a fairly common condition affecting older people, generally aged over the age of 60. It affects around 1% of people. This condition can start fairly suddenly, and typically what will happen is a constellation of symptoms such as neck pain, shoulder girdle pain, and pelvic girdle pain. So typically you'll find stiffness in the shoulders where you may have difficulty lifting your arms in the air, stiffness around the hips where it can be hard getting up from a seated position or from bed, and typically symptoms are worse at rest. So morning time is a particularly bad time, and when you loosen up it may be a bit easier by the afternoon. So the symptoms are the main way to try to identify this condition. In terms of how to further identify it, you may do blood tests, and here you'll see raised inflammation in the body. The two markers that are checked on blood tests is called the CRP or ESR, and typically these are quite raised from baseline. The reason is the condition is due to inflammation in the body, and it's where the immune system is inflaming certain parts of your body. This can be the joint, it can be the areas around the joint such as the capsule, it can be the bursa, and even the muscles. And polymyalgia actually means pain in many muscles. So the inflammation is what's driving your problem. Whenever we identify someone who may have PMR, we always ask about a separate condition called giant cell arteritis or temporal arteritis. This condition is where there's inflammation in the blood vessels, and it can lead to headaches, jaw pain, scalp pain, and is a potentially quite a serious condition. So we certainly don't want to miss it. The reason we ask about it is because many people with GCA or giant cell arteritis will also have polymyalgic symptoms, so it's very hard to tell the difference. This will require further investigations and further tests, but it's something that you should be aware of if you have polymyalgia rheumatica. I'll be talking about the treatment of PMR in a different video, so please have a look at that one, and I'll take you through how I manage this condition.